How to control diabetes with 12 tips and reduce the levels of glycated hemoglobin. In this video, I will tell you everything about diabetes, what has scientific proof, and I will not sell you any kind of supplement. This is an informative video. It has nothing to do with indicating some medicine or supplement or something like that. So if you are waiting for some miraculous medicine, this video is not for you. It is for those who really want to learn about diabetes and tips that are proven. I will tell you here a lot of scientific evidence and also a little of my experience. I am an endocrinologist, specialist in diabetes. First, as we are talking about glycated hemoglobin, you have to understand this concept. Glycated hemoglobin is a blood test that we use to evaluate the average of sugar in the blood of the last 90 days. This test can make an average and give a value, and through this value, we can know how the diabetes control is. And also the risk of the patient having a chronic complication of diabetes, a disease in the eyes, the so-called diabetic retinopathy, in the kidneys, diabetic nephropathy, and even the risk of having a heart attack, for example, a cardiovascular disease. What is this value? First, what are the values of normality? Up to 5.6 is a value considered normal for glycated hemoglobin, 5.7 to 6.4 for diabetes, 6.5 or more. Always remembering that for the diagnosis of diabetes it must be repeated twice or be associated with another exam. So 6.5 or more for the diagnosis of diabetes. And what is the value of glycated hemoglobin in the treatment of diabetes? Around 7%. Why did I say around? Because this value is not fixed. Many times the doctor can aim for a value less than 7. 6.5, for example, the patient has a low cardiovascular risk, and sometimes this value, the treatment goal, can also be greater. 7.5, even 8% of glycated hemoglobin in that patient who cannot have hypoglycemia, who has a high cardiovascular risk, who has a heart-related ischemic disease. Why? Because in hypoglycemia what happens? The levels of adrenaline increase, the body increases the production of cortisol, which happens with the heart. It ends up beating faster due to the release of adrenaline. So often this value can be a little higher, but on average, as I'm speaking here, this standard would be around 7%. I want you to understand this glycated hemoglobin test well. Why? Because it also has flaws. For example, if the test sees the average in the last 90 days, if you do the glycated hemoglobin test before 3 months, 2 weeks after starting the treatment, for example, the result will be a false result, because it will reflect the previous period. So it is important to respect this 90-day interval between one test and another. This is a very frequent cause of treatment errors, because the doctor ends up looking at that test and says, "Oh no, but I made modifications and even so it didn't help. In fact, you did the test before time." So respect the 90-day interval to do a new glycated hemoglobin test, as you have already seen, which is the average of the last 90 days. This is the first observation. Other situations can also alter and give a false result of glycated hemoglobin, such as those who have renal failure, who have a damage to the filtration of the kidneys, of the function in fact. If the kidneys are not working well, the result of glycated hemoglobin will be false. You will not be able to trust. When the patient has a situation like renal failure or even a hemoglobin disease, a change in the red blood cells such as anemia, for example, there are other ways to check how the diabetes is controlling, such as the measurement of the finger with a glycosimeter. We can measure the average blood sugar by the measurements of the finger. It is also a method. If you have renal insufficiency, there are other ways to check how the diabetes is controlling. Another situation that can also falsify the levels of glycated hemoglobin is when the patient is having a lot of hypoglycemia. Why? As is the average, if you are having results below 70, 45, 50, and other times you are having hyperglycemia, high results like 250, 220, what can happen? You can put these results together and give an average, and the average becomes good, when in fact you look at the treatment of diabetes and it is not good at all, because you are doing both extremes. You are doing hypoglycemia. So, if you are having a lot of hypoglycemia, you have some symptoms of hypoglycemia, such as sweating, tremors, mental confusion, palpitation. You have to write this down and talk to a doctor, because the glycated hemoglobin test will not be a good parameter. Other means, like the one I mentioned through the finger test, can also be used to make an average and estimate how this control is. Now that you have understood what glycated hemoglobin is for, let's talk about how to reduce it, how to control diabetes with 12 tips. Number 1, have a routine. It is essential that you have a routine, sleep and wake up at the same time, but it needs to be always not, but most days. Why do I say this? Because whenever I comment with patients, many ask, But if I have a graduation, if my son is graduating, well then, on that day, you can leave the routine. No problem. What really matters is that your body knows how to recognize the parts of the day. So most days, you have to sleep and wake up at the same time. Because our body follows a cycle during the day, called circadian cycle. And naturally, in the morning, when you wake up, cortisol production increases. Other hormones are also increased, such as glucagon, growth hormone, adrenaline itself. And that way, if you have a routine, your body can understand. And it is easier for you to control the levels of sugar in the blood. This is already studied. People who do not have a routine end up inverting, end up sleeping all day, then they stay awake at night. The next day they stay awake during the day, then they sleep at night. So it gets harder for the body to know when it has to produce certain hormones. Since I'm talking about routine, it's important that you sleep at least 6 hours a night. If you sleep less than 6 hours, there are studies that also relate to an increase in the frequency of diabetes. There is a discussion. What would be the time? 6 or 8 hours, for example. Let's stay here with 6 hours at least, because I know that not everyone can sleep 8 hours a night. If you can, even better, but if you respect this interval, minimum of 6 hours, it also has the benefit of controlling sugar in the blood. I'm including this sleep tip here in tip number 1 of the routine, so it won't have an isolated tip. And tip number 2, in this tip here, many people laugh, but it is scientifically proven, so it's not worth laughing. But if you follow it, you'll have better control, which is about the size of the plate. If you reduce the size of the plate, it is already proven that your brain has less stimulus to eat more, because you end up seeing the full plate, even if it's a smaller plate, and you eat less. So, you can control the levels of sugar in the blood in a better way. And many people also comment, several people, I even think it's a joke as I said, but many comment, this tip won't help at all. Why? If the person can't put it on the plate, the person will end up increasing. It will make a mistake. It will increase the amount, will increase the height of the plate. But this doesn't happen because it goes beyond our understanding. It's not rational, but for our brain it does help. It gets more satisfied. It ends up looking at the full plate, let's say a smaller plate, and you eat less. So that's why in buffets, in restaurants, there are many that serve per kilo. You can see that the plate is very large. It's for you to serve more. It's proven. The recipe is true. If you eat less with a bigger plate, you eat more with a bigger plate. Sometimes you end up taking, and it's just by impulse you go, I'll eat, I'll eat, I'll eat. And when you get to the table, you'll eat, I really took too much. It's not worth reducing the size of the plate. It's a very simple tip, and it gives results in the long run. Number 3, this tip here is very important in your treatment, which is to write down the periods that you had an infection, a flu, or a very strong stress. Because that way the doctor can interpret it in a better way and not take a hasty conduct. For example, because in the periods that you have an infection, it can be a urinary infection, or an airway infection, like a flu, for example, or even pneumonia. You have to write it down in your diary. Because the diabetic has to have a diary for you to write down the most important thing. Many people are surprised when I say this, but I don't want to be too boring to have a diary. So tip number 3 is to have a diary and write down the most important things, like, for example, a flu. Why? Because what happens when you have an infection? Does the sugar levels decrease or increase? You know, right? The levels increase because the body tries to fight the infection. And in a physiological way, the levels, in a natural way, let's say, the sugar levels in the blood during the infection are elevated. It's the body's defense mechanism. And if the doctor doesn't know you had this infection, he can confuse your treatment. So write down stress periods and these important changes. It will facilitate the analysis, and it will also help you. You will be able to better understand diabetes, so have a diary. I know it's boring. Another thing that is worth it is to write down what you're eating. For example, it doesn't have to be exactly the portions. It's hard to have a scale together, right? You go to a restaurant, but write down the food. It will make you more clear when deciding. This is also proven. It helps you. So, are the tips worth it? What do you think? It's only the 3rd one. Look how many things I've already said. If this is helping you, I ask you to like this video. Let's set a goal of 10,000 likes. No, 12,000 likes. 1,000 likes for each tip. And so, the video is more distributed. The platform understands that the video is interesting and ends up sending it to more people. And there are many diabetics who need it, because the 4th tip is related to this, which is to understand about the disease and stop believing in some miraculous supplement. I said I wasn't going to sell anything here, so pay attention to these miraculous advertisements, sponsored videos. Why? Because there is no miracle in diabetes treatment. What exists is you getting these tips, getting the doctor's guidelines, his prescription, and really follow it day by day. Have a routine. And then, in the long run, you can get the result. And if you understand about the disease, if you watch the videos, if you get this information, this is not the doctor who has to know. This is you who has to know. because you can have a better understanding. But this is the doctor who has to know. Negative, you have to have this knowledge, because the doctor will not be there 100% of the time to help you make better choices. The nutritionist will not be there to check what you are eating, to say if it is right or wrong. So you have to follow the guidelines, but you have to have the knowledge. For example, think quickly now. Do you know which is the best fruit? Guava, orange, or mango? If you don't know, you have to study more about diabetes, because you need to have this knowledge to, in the day-to-day, make better decisions and be able to control the sugar levels in the blood. So, tip number 4, understand about the disease, how diabetes works, and also not believe in any supplement. There is no conspiracy of health professionals, nutritionists, nurses, doctors, who do not want to reveal the secret. It's because there really is not just one secret. There are several, as I'm commenting on this video here. So, number 5, let's go on. Drink water. If you are hydrated, you can also better control the sugar levels in the blood. First, because the diabetic has a tendency to be dehydrated, especially when the sugar levels in the blood are higher. To compensate for this, the kidneys end up eliminating sugar, and along with sugar, water too. So, that's why, when the sugar in the blood is very high, you have an increase in thirst. Consequently, also end up urinating a lot. It's because of that. So hydration, what would be a good level of hydration? For example, I have 100 kilograms. Many people ask, oh, you have 100 kilograms? I have 86, and I practice physical activities note here. Because many people find it strange, oh, you have 100 kilograms. It can't be so. 30 milliliters in my case. 3 liters of water per day. This divided into 4 or 5 times. And another important tip about water, that besides having other benefits, many times you are thirsty, and the brain confuses it as being hungry. So you end up eating when you are actually thirsty if you are always hydrated. It will also help you in controlling, for your brain. Actually, not to confuse this stimulus of thirst with the stimulus of hunger. So it's very important. Besides protecting you from dehydration, it also has this additional benefit. There are some exceptions here. There are patients who have medical indication of not consuming so much water, in the case of a very unbalanced heart failure or a kidney failure. So this note is here, but in general, 30 milliliters per pound. This divided is a good number for you to stay hydrated. Tip number 6, add fibers like chia flax. Because what is the mechanism of the fibers? What is the function of the fibers? They help digestion. They end up delaying the absorption of carbohydrates, for example. So if you were going to eat a banana, if you put chia, for example, you will not have that peak of sugar in the blood, because the absorption will be slower. This helps you to reduce the levels of sugar in the blood and the levels of glycated hemoglobin. You remember that glycated hemoglobin is the average. If you don't have a peak, delay the absorption. This will also help in the control of diabetes. This is also true for foods that are rich in fibers, like, for example, if you eat an orange, if you drink orange juice, what is better? Many people think it's drinking juice. Why? If you eat an orange, you have juice and something else. But these things are the fibers, and if you drink juice, let's follow this example. It will make a peak of sugar in the blood. Soon you will have a peak of insulin. And for the diabetic, this is not good if you eat the orange. The orange fibers will delay the absorption of carbohydrates and will improve the levels of sugar in the blood. It will be easier for you to control. It will not make the peak of insulin, the peak of sugar in the blood, so it will be good for the control of diabetes. So add fiber. Very important are tip number 6 and tip number 7. Also very important, beware of healthy foods, but caloric-like. For example, chestnuts, peanuts, cashew nuts, para nuts, and even avocados are healthy foods. They are extremely healthy, but you have to take care of the amount because they are extremely caloric. Have good fats? Does it do good for our body? Yes, but if you consume them in excess, what will happen? You will make an excess of calories, will get fat. And what does the adipose tissue, the fatty tissue, do? Makes insulin action difficult. So your body has to produce more insulin to try to compensate for this. Or if you have type 1 diabetes, for example, and you end up using insulin, you will have to use a higher dose of insulin, and it will make it difficult for the diabetes to be controlled, the levels of sugar in the blood. So beware of healthy foods. Try to know how many calories you have per serving. It is essential for the control, okay? When I say, for example, that a handful of peanuts or chestnuts from para, a handful, that fits in the hand, has an average of 500 calories. Many people get scared. How so? So try to know before consuming, have a notion. What I said about understanding the disease, so you don't overdo it in some healthy foods. The same goes for olive oil. Is extra virgin olive oil healthy? Yes. Should you consume it in a salad? Yes. but you have to be careful with the amount, because the excess will make you gain weight and will make it difficult to control the reduction of the implied hemoglobin. Number 8. Practice physical activity, exercises. Walking, running, weight training, hydrogymnastics, even physical activity at home. Why? It helps you a lot in the metabolism of sugar. If you increase lean mass through physical exercise, the muscle also consumes glucose, and in a proven way, it helps in the control of diabetes. It's a great ally. It's one of the most important tips. What is the physical activity time for you to have these benefits? At least 150 minutes a week, divided into 3 or more days. So, 30 minutes, 5 times a week, would be enough for you to enjoy these benefits. I always encourage the practice of activities because not only for the control of sugar in the blood, but it has several benefits. At the end of this video, I'll leave a suggestion and a tip for you to start, for you to do more often physical activities. So don't forget to watch, stay until the end. Number 9. Foods rich in magnesium and chromium. The role of magnesium and chromium, along with insulin, in insulin resistance, in this case, that I mean here. Why? Diabetic people have a higher prevalence of magnesium deficiency because it can eliminate the urine, for example, and if you consume foods rich in magnesium, you can have better control of diabetes. I'm not talking here about supplementation. I'm talking to you about consuming through the diet. What are these foods that are rich in magnesium? Lentils, pumpkin seeds, sunflower seeds, dark green leaves. It's not that hard to find, right? Because many people think, where am I going to find pumpkin seeds? But dark green leaves like spinach, kale, cashew nut can help you consume the daily needs of magnesium, for example. And it covers foods like whole grains, lettuce, broccoli. So pay attention to how your diet is. Tip number 10. And this one you already know, which is not smoking. Cigarettes are also associated with worse glycemic control. If you want to improve the levels of glycated hemoglobin, then don't smoke. It can also help you to reduce the risk of cancer and other diseases. It can increase the risk of cardiovascular diseases. I'm not going to go into this topic because you already know. Tip number 11. Avoid simple sugar. Or consume a small amount. Have a control on the amount. It will also help you in the sugar levels in the blood. Because imagine you eat a cake with refined sugar on top. What will happen when you do the digestion? You will have a peak of sugar in the blood, a peak of insulin, and you know it will be worse for your hemoglobin control. Now that you understand this mechanism, things are starting to make sense. So, simple carbs, simple sugars, have a higher moderation, a higher control. You have to pay attention to certain foods. And tip number 12, about weight control. Have you ever seen that excess calories will cause weight gain or adipose tissue gain? And how important is it for the metabolism to control weight? There are studies that verified the levels of hemoglobin, the control of diabetes, and they followed people who reduced between 5% and 8% weight. So, the example of 100 kilograms, if you do a modification, a reduction to 95%. For example, it has a proven metabolic benefit scientifically. So, you have to pay attention if you can reduce weight, along with all these tips that I said for sure. You will have a much greater chance of controlling the sugar levels in the blood, have better control and decrease the chronic complications of diabetes, improve control, have better quality of life. So this is the result from 0 to 12. 12 is the maximum. So if it's 12, I will make more videos like this also. Write which city you are watching, which region, which country, which part of the world you belong. I'm from Porto Alegre, Rio Grande do Sul. Right here for me. I always like to read. Now I will leave a suggestion for you to watch. I mentioned the importance of physical activity for diabetes. There are other benefits and also the tip that will make you increase the frequency that you practice activity. In this video, I talk and explain about it